Hi, I'm Menace Joannides, Chief Medical Director at Optimum Re, and this is the Optimum Academy. And this video is on PrEP and HIV 101. This is video number 1, PrEP. So let's get started. So what is PrEP and what medications are used? What is the HIV virus? What secret agent does the HIV virus use to replicate and reproduce? What medications are used to either prevent or treat HIV positive applicants? And we're going to talk later on videos in this sequence about HIV positive applicants and what are other high risk factors. But this video is basically intended to convey information about PrEP. So PrEP is pre-exposure prophylaxis for HIV. It's taking routine antiretroviral medication to prevent infection with HIV virus. So this is a preventative. This is before anyone tests positive for HIV. So in people who are testing negative for HIV that are at risk for HIV virus, PrEP is a useful medication regimen to take. The reduction of risk is 99% using the medications that are available today. So that's an incredibly optimistic and favorable situation if people take their medication as prescribed, but they must continue to take it as prescribed. They can't miss doses or fail to renew their prescriptions. The drugs that we often seen that are used in PrEP are Descovy, and that's a combination of two medications, which I've listed here. And it is a newer preparation from Gilead, the drug company that makes it, versus Truvada, which was used in the past, which has the similar two medications. However, you'll notice that the second medication, tenofovir, is now in a TAF formulation rather than a TDF formulation, and we'll talk about that in a minute. Apretude is an extended release injectable suspension which can also be used for PrEP. You may see that advertised on television as well as Descovy now. Truvada has fallen out of use, and we'll talk about that in a minute, why that happens to be. But these are the three main drugs that have been used for PrEP, and you'll notice the first two are combination drugs. If a combination of antiretroviral drugs are being taken, in addition to, say, these two drugs, you need to check and make sure that the applicant is not already HIV positive. So these are the drugs that are used for PrEP, but carefully check the APS to make sure that the applicant is not already HIV positive, which would require additional medications. The use of PrEP meds should not be a cause for any underwriting ratings or any adverse underwriting action. So the fact that an applicant is using these medicines to prevent the HIV virus infection should not require you to write anything in the notes in a negative fashion about the use of PrEP medications themselves. I'm going to talk about Apretude in a bit, or in this lead-in and maintenance that has to be done regarding Apretude. So this is the injectable, long-acting medication. However, there is an initiation phase. So patients will initially need to be on oral medications to prevent HIV infection as a lead-in. Then the first injection of Apretude is after the oral medication has been used and patients receive the Apretude injection intramuscularly. The second injection is given approximately 4 weeks, 1 month after the first injection. So this lead-in is oral medicine first, then injections. This is to make sure that the applicant or patient can take the medication. And then, of course, the maintenance has to be continued every 2 months after those first 2 injections. And if the person does not continue the maintenance, they're subject to being at risk for contracting HIV if they put themselves at risk. So missed doses would be a problem, and you need to check the APS to make sure the person is taking their medication as prescribed. With PrEP, an applicant can still get sexually transmitted diseases if sex is unprotected. So PrEP needs to be taken as prescribed to be effective. Skipping doses is unfavorable. Applicants should be checked regularly and under a physician's care if they're on PrEP. And as I said, avoid writing any underwriting notes concerning lifestyle choices for applicants who may be taking PrEP. Tenofovir, one of the drugs that was in those combination PrEP medications, is also used to treat hepatitis B. So if you see this listed in a drug check, a RX check, you have to be sure that which disease is this being used for? Is it being used alone for hepatitis B, or is it being used in combination with other drugs for HIV prevention in PrEP? That completes our video on PrEP. Stay tuned for continuing videos on HIV positive applicants.